I originally had a heart attack in 1998, which was um, quite severe, and I was quite lucky because I was in the middle of the city, and I still had enough presence to call 000 and get an ambulance to pick me up in off the sidewalk. Um, After I recovered from the heart attack with a stent in the main artery of my heart, um, I did slow down a bit. Then about 9 years later, uh, having a procedure in hospital, it was discovered that I had a very slow heart rate. For my normal heart rate was slowing down to about 30 beats per minute.
I have a condition called atrial fibrillation, which the blood pools in the top chamber of your heart, and it's like a irregular heartbeat. And the pacemaker was put in to fix, I was told originally to fix the atrial fibrillation.
I was going with my family, my sister, her husband, her two boys. One's had a wife and the other one a fiance, to Thailand for the younger one to marry in Thailand. Roughly 36 hours before the departure time, I went shopping. I felt a bit woozy, thought I'll go and see my doctor. Next thing, he's called an ambulance. Next thing, I'm in hospital and diagnosed with bradycardia, which is irregular heartbeat. For me, it was like, wow, I just couldn't imagine that I would have a heart problem, because a lot of these heart conditions are hereditary. There's been no history in my family. So here I am, they found something wrong with my heart. Where did this come from? So that was really scary for me.
Talking to the doctors about it and asking them, they actually gave me the option. He gave me time when he said, you need a pacemaker, but I want you to go and agree to having it put in and think about it.
When the cardiologist originally said, well, he was going to put the pacemaker in, and I was always felt that I was pretty well invincible anyway, but this was something that was, wow, this needs to be done. And he did explain the risks and the risks of putting these wires through the artery and then fitting a pacemaker in my chest, and all the procedures that went along with it. The alternative to not having it, of course, was a very poor quality of life. And the risks, as he explained, were really quite minimal. But nevertheless, there were risks there. And I guess you've still got to consider those risks.
This was a huge thing for me, a huge shock. They were very reassuring. They explained what was happening. They basically said that once the pacemaker's implanted, that my life would be back to normal.
I think they were very honest with me, telling me, look, there are things that can happen, and it can happen to people. So I need to tell you this, and this is something you need to consider. And so I think that was the most important thing, I think. And also knowing, how it will affect me afterwards, and if it will make me feel better afterwards, which it did.
I was quite confident that I would be okay, and it brought me back to life mentally and physically.